Welcome to the Policy Visibility Drive, a Ghana Health Service policy initiative created to enhance the exposure of policies, manuals, and guidelines within the health sector. In this video, we shall be focusing on the Ghana Health Service Policy and Strategy on Digital Health 2023 to 2027. The goal of universal health coverage is to ensure quality, accessible, and affordable health services for all without exposing clients to financial hardship. As health system strengthening continues to be a national priority in Ghana, the effective and efficient use of information and communication technology is increasingly recognized as a major enabler for improving service delivery, strengthening training of health personnel, and advancing research in the health sector. Over the years, Ghana has made significant progress in eHealth, including earlier strategies such as the 2010 eHealth strategy, which sought to streamline the regulatory framework for health information management, build sector capacity for wider application of eHealth solutions, bridge equity gaps through ICT, and advance paperless records and reporting systems. Globally, the World Health Assembly has consistently encouraged countries to strengthen eHealth and digital health efforts, including the development of national policies and legislative mechanisms linked to broader eHealth strategies. Within this context, the Ghana Health Service acknowledges that a strong policy and strategy is needed to guide the creation, scaling up, integration, and long-term sustainability of digital health solutions, while ensuring protection of privacy, confidentiality, integrity, and availability of data. The service also recognizes that health data is sensitive, and due to its critical nature, the Cybersecurity Authority has classified the Ghana Health Service as a sector with critical information infrastructure. This makes the case for strengthened governance, standards, compliance mechanisms, and security safeguards across the digital health ecosystem. The World Health Organization defines digital health as the field of knowledge and practice associated with any aspect of adopting digital technologies to improve health, from inception to operation. Digital health incorporates eHealth and focuses on issues such as scalability, replicability, interoperability, security, and accessibility. The development and implementation of this policy and strategy is guided by key principles, including client-centeredness, open standards and open source, digital competent health workforce, multi-sectoral approach and strategic partnerships, evidence-based innovations for sustainability, quality-driven approaches, data security, efficient use of resources, leveraging existing assets and capabilities, interoperability through seamless and secure information exchange. These emphasize that digital health must improve real service delivery outcomes, protect clients, strengthen the workforce, and deliver value for money while avoiding duplication and fragmentation. The overall goal is to contribute to increasing access to comprehensive and quality health services through the use of ICT by 2027. The policy defines 10 strategic objectives. 1. Strengthen governance and accountability systems for digital health at national, regional, district, and sub-district levels. Key implementation actions include instituting oversight structures to drive delivery of action plans, ensuring continuous professional training for ICT units at all levels, resourcing digital health appropriately, and establishing robust reporting systems to monitor implementation of digital health interventions. 2. Create an enabling environment for implementing digital health solutions. Implementation under this objective includes strengthening policy and regulatory frameworks to ensure client safety, data security, confidentiality, and privacy, ensuring qualified human resources are available to develop and maintain digital platforms, and improving ICT infrastructure to support digital health service delivery. 3. Improve accessibility, efficiency, equity, quality, and continuity of care through digitalization of health service delivery, Implementation strategies include automating routine processes in service delivery, strengthening client feedback systems, integrating digital tools into continuous quality improvement initiatives, supporting auditing and financial/procurement/logistics systems, and strengthening referral and continuity of care through reliable digital solutions. 4. Strengthen disease prevention, surveillance, detection, reporting, response, and control at all health system levels, recognizing the country's high penetration of mobile phones and networks as an opportunity for eHealth approaches that support healthy behaviors, early interventions, and public health promotion. 5. Improve the security of health ICT infrastructure and data. Implementation strategies include strengthening physical security safeguards for eHealth infrastructure, enhancing data security and privacy, strengthening digital privacy mechanisms, and improving organizational awareness on information security. 6. Improve interoperability and connectivity of all ICT systems to strengthen enterprise architecture and interoperability across systems to reduce data errors, improve data quality, and eliminate silos. 7. Build a competent health workforce using digital technologies through continuous professional development, structured capacity building, and mainstreaming e-learning and micro-learning services. 8. Promote collaboration and advance the transfer of knowledge among ICT personnel, creating channels for peer learning, knowledge-sharing hubs, exchange programs, and strengthened collaboration with ICT service providers. 9. Promote public-private partnerships as a pathway to share costs and risks, strengthen implementation so that technical, social, and financial agreements protect the interests of the Ghana Health Service. 10. Mobilize resources for digital health. The strategy emphasizes creative and deliberate efforts to mobilize internal and external resources, maximize existing assets, ensure efficiency, and reduce overdependence on donor support.
If you've liked this video so far, give it a thumbs up and subscribe to the official YouTube channel of the Ghana Health Service. Comment down below as well to let us know what you think, and click the card above to view all Policy Visibility Drive videos.
Monitoring and evaluation. The expected outcomes of this policy and strategy include enabling electronic access to appropriate health services, including for remote and hard-to-reach populations, improving quality and efficiency of clinical practices through better access to information and decision support tools, enabling accurate and timely reporting for better policy and investment decisions, reducing fragmentation and duplication through integrated systems, strengthening continuity of care across the service delivery continuum, improving forecasting and preparedness for outbreaks, ensuring sustainability of effective digital interventions, and building a competent ICT workforce within the service. To ensure the strategy is implemented effectively, monitoring is supported through structured review systems, including periodic reporting and annual review processes to assess progress, identify gaps, and strengthen decision-making. This approach ensures that implementation is tracked across the full strategy period, from year 1 through year 5, while supporting accountability and continuous improvement. Management arrangements. The policy establishes 4 functional management arrangement structures with clear roles and responsibilities. 1. Office of the Director General. At the apex of the arrangement is the Director General, responsible for establishing and overseeing standards and guidelines for ownership, compliance, and security in the digital health ecosystem, and mobilizing resources for strategic investment in digital health initiative. 2. National Digital Health Steering Committee. The NDHSC provides strategic leadership and oversees implementation of the policy and strategy, ensuring alignment across digital health initiatives within the service. 3. Digital Health Technical Working Group. The DHTWG provides technical guidance, monitors and evaluates implementation, establishes task teams for specific digital health tasks, develops costed annual action plans, ensures proper use of allocated resources, enforces compliance with standards and guidelines, provides mentorship and supportive supervision, and compiles and submits implementation reports to the NDHSC. 4. Regional Digital Health Technical Committee. At the regional level, the RDHTC oversees implementation of digital health initiatives in the region, enforces compliance with standards and guidelines, provides technical support to districts, coordinates stakeholders, conducts supportive supervision and mentorship, and submits quarterly reports to the DHTWG.
Please note, this video only contains an abridged version of the policy document or publication. To access the full document or for further reading, kindly visit the Ghana Health Service website at www.ghs.gov.gh. Thank you for your time and attention.